Imagine waking up feeling completely fine, only to be struck hours later by an intense fever, pounding headache, and severe body aches so excruciating that the illness is sometimes called breakbone fever. This is the reality for millions each year who contract one of the world's most widespread and rapidly growing mosquito-borne diseases, dengue, affecting up to 100 million people annually and causing about 20,000 deaths worldwide. Dengue is a serious global health concern, especially in the tropics and subtropics. Today, we'll break down everything you need to know about dengue, its symptoms, diagnosis, treatment, and most importantly, how to prevent it. Let's begin by understanding the nature of this disease. Dengue is caused by a virus, specifically one of 4 related serotypes of the dengue virus, which is transmitted primarily by Aedes mosquitoes. These mosquitoes thrive in warm, humid environments and are most active during daylight hours. Dengue is prevalent in Southeast Asia, Central and South America, the Caribbean, parts of Oceania, and the Indian subcontinent. However, cases have also been reported in parts of the United States, including Hawaii, Florida, and Texas, usually in travelers returning from endemic regions. The global spread of dengue has been accelerated by factors like climate change, increased travel, urbanization, and the expansion of mosquito habitats. Now let's dive into the first important segment, symptoms of dengue. Dengue often begins suddenly. Typically, symptoms start about 3 to 15 days after a person is bitten by an infected mosquito. The first signs are usually a high fever and chills, accompanied by a severe headache and significant pain behind the eyes. One of dengue's most distinguishing features is the intense muscle and joint pain, which can be so severe that it feels as though your bones are breaking, hence the nickname breakbone fever. Fatigue is profound, and patients often feel exhausted and weak. Swollen lymph nodes and a flushed red facial rash may appear briefly. After 2 to 3 days, these symptoms may seem to subside, leading to a brief period where the person feels better. However, the fever may return, and a new rash, blotchy red spots, can appear, first on the backs of the hands and feet, then spreading to the arms, legs, and torso. While most people recover after about a week, lingering weakness may last for several weeks in severe cases. A dangerous complication, known as dengue hemorrhagic fever, can develop, especially in children under 10, and in those experiencing a second dengue infection. In this severe form, the immune system's aggressive response damages blood vessels, causing them to leak fluid or blood. This can result in bleeding from the nose, mouth, gastrointestinal tract, or even puncture wounds. Patients may vomit blood or pass blood in their stool, and purplish spots may develop under the skin. In the most severe cases, fluid can leak into the lungs, making breathing difficult, and blood pressure can drop dangerously low, leading to shock. A life-threatening emergency. Next, let's look at how dengue is diagnosed. Diagnosis relies heavily on clinical symptoms, those hallmark signs like sudden fever, severe headache, and body aches, especially if the patient lives in or has recently traveled to an area where dengue is common. However, because symptoms of dengue can resemble other illnesses, especially other viral infections, laboratory testing is crucial for confirmation. Doctors typically perform blood tests to detect the presence of the dengue virus or antibodies the body produces to fight the virus. These tests help differentiate dengue from similar diseases, such as malaria, Zika, or chikungunya, and are vital for identifying severe cases that require close monitoring. Now let's move on to treatment. Unfortunately, there is currently no specific antiviral medication to cure dengue. Treatment is mainly supportive, focusing on relieving symptoms and preventing complications. The most important thing is to rest, stay hydrated by drinking plenty of fluids, and manage fever and pain with medications like acetaminophen. It's crucial to avoid non-steroidal anti-inflammatory drugs like aspirin and ibuprofen, as these can increase the risk of bleeding. For severe cases, particularly dengue hemorrhagic fever, treatment in a hospital is often necessary. Intravenous fluids and, if needed, blood transfusions are administered to manage dehydration and blood loss. Close monitoring of vital signs and blood tests ensure that any complications are detected and treated promptly. Early medical attention can be life-saving, especially in cases where shock or severe bleeding develops. Let's turn now to prevention, the most effective way to combat dengue. Since there is no widely available vaccine for dengue and no specific cure, prevention focuses on avoiding mosquito bites and reducing mosquito breeding grounds. Here are some key measures. 1. Use mosquito repellents on exposed skin and clothing, especially during daylight hours when Aedes mosquitoes are most active. 2. Wear long-sleeved shirts, long pants, socks, and shoes when outdoors, particularly in areas where dengue is common. 3. Sleep under mosquito nets, especially in areas without air conditioning or when sleeping outdoors. 4. Eliminate standing water in and around your home, as this is where mosquitoes lay their eggs. Empty flower pots, buckets, old tires, and other containers that can collect water. 5. Use window and door screens to keep mosquitoes outside. 6. Community efforts, such as organized cleanup campaigns and public health education, are crucial for reducing mosquito populations. If you're traveling to an area where dengue is present, take extra precautions. Even a single infected traveler can introduce the virus to new regions if local Aedes mosquitoes are present. To summarize, dengue is a serious mosquito-borne viral infection with symptoms ranging from high fever and severe body aches to life-threatening bleeding and shock in severe cases. Diagnosis requires a combination of clinical evaluation and laboratory testing. While there's no specific cure, prompt supportive care can greatly reduce the risk of complications and death. Prevention, through personal protection and community action, is the best defense against this widespread disease. Thank you for joining us to learn about dengue. If you found this information helpful, don't forget to like this video, share it with your friends and family, subscribe to our channel, and turn on the bell so you never miss our latest and most interesting health videos. Stay safe, stay informed, and see you in the next episode.